So I think there's very little doubt that we are witnessing the demise of the NHS, at least as we've come to know it, as a place where we get access to all treatments available when we need those treatments. This has been happening for a long time, of course. Over the last decade, we've witnessed the takedown of this public service and in its place a growing private sector and a will to see the profit be created from our health needs. But my question today is there a point where we can see the NHS being delivered its fatal blow? And my question is whether that was the 14th of December. So as context, at that time, the NHS were dealing with about 6,000 new admissions from COVID per week. That's about 6% on top of all medical admissions. We've been dealing with that for many months. We could see the strain coming through in the ambulance service as an indicator of how much difficulty we were having. We were more than double the response time to Category 2 calls, which is the calls for stroke and chest pain and such like. And this was prior to this massive spike. The hospital capacity was already 9% above its safe limit. So it's this context that led to NHS bosses saying that the NHS was already at breaking point. This was in November. And we can see the excess deaths that 1 in 10 people that were dying at the time wouldn't have died had we controlled COVID better, or perhaps even resourced the NHS better. And at the same time, this was actually in October. This was in October where NHS chiefs had been calling for more mitigations, perhaps not for the reasons directly of saving COVID lives and of preventing disability, which would have been a good enough reason, but on the basis that if it continues at this level, then we won't be able to provide urgent care for all the other conditions that we need to do. And then Omicron came, and the most transmissible variant to date. And whilst absolutely the mortality rate, or certainly the fatality rate, was significantly lower, due to how transmissible it was, there were really grave concerns about how bad this would hit the country. And these were the calls that, we're going to get a big wave. It's going to put huge pressures on the NHS. Lots of staff are going to go off. And again, we're going to slip back into this position where the NHS is unable to provide urgent care to the public. And this was the day that the MPs voted on whether to reinstate public health mandates. And while the vote was actually successful, thanks partly to Labour support, there was a significant rebellion from Conservative MPs. It made international news and heralded a loss of control of Johnson and his party. The basic argument being, if you're going to continue with mitigating against COVID, then you will lose our support. And it led to some quite wild claims from some Tory MPs.
Matter of opinion. We decide what our risk appetite is and what we're prepared to encounter and what we're prepared to not. Notwithstanding the carnage on our roads, certainly killing more people than COVID at the moment, some of us still decide to drive.
Of course, it's a ludicrous claim that fatalities on the roads were anywhere near COVID death rates. This is the government's own figures. Almost 2,000 dying on the roads in Britain in 2018. At the time that comment was made, we were getting that many deaths from COVID in about 2 to 3 weeks. So it was a ludicrous claim, whether knowingly so, I guess we'll never know. But these were the pressures on the cabinet at that time and the government at that time. And they were actually considering circuit breaker, a 2-week circuit breaker, to dampen down the pressures on the NHS and save lives. Of course, I mean, that would have been the outcome. And the government's own scientific advisory groups were calling for more stringent measures than Plan B to try and salvage things. But then there was the other side, and the other side were trying to remove mitigations from COVID, get people spending again, and there was a lot of pressure from Conservative MPs on Johnson. And I think the Independent sums it up best here, that actually, even if Johnson, who is known to be acting too little too late on so many occasions, we suffered months of lockdown when it could have been weeks had Johnson moved at the right time. Even his lacklustre approach to the pandemic was paralysed because of the Conservative Party division and a significant number either not comprehending the impact this was going to have on the British people and the risks that would put us in, or for some other reason. And let's not forget that Johnson was also facing Partygate. These were the parties that were reported. The average daily deaths during these parties were 330, and he had taken a massive hit in popularity because of that. So we have a Prime Minister who was becoming more unpopular, who was losing the support of his party, and frankly didn't have the gall to stand up for the safety and protection of the British people, and obviously chose his own political survival over the survival of thousands of the British people. So this was the point at which the decision was made, and then we saw thousands and thousands of additional hospital admissions over that time, with a very predictable effect. You can see the inflection here of the increase in the waiting lists, approaching 7 million now. You can also see here what is a 12-hour wait to be admitted to hospital from A&E. And this was something that was almost unheard of, for someone to have to wait in A&E for 12 hours to be admitted. Back here, it had started to creep in as a problem, and then obviously the pandemic hit and it started to become more of a problem. But here we see we went from 10,000 and now we're up to 16,000 after that decision, and now we're up to 22,000 in July. And we know this means people are dying. I mean, we have a very clear association between 12-hour waits and people dying waiting for care. So undoubtedly, the additional burden put on by an unmitigated or a relatively unmitigated Omicron wave, 2 waves, now on our 3rd wave, has buckled an already neglected NHS with huge consequences for the public. If you're unfortunate enough to develop cancer symptoms during that time when the decision was made, we dropped to the worst ever waits for 2-week waits for referrals. And if we look here, we ended up with 40% of people with cancer waiting more than 2 months to start treatment, which is absolutely shocking. Waiting lists are growing, and I'm afraid the conditions the NHS is in for working is too much. We have the record resignations, 7,000 per week at last count, and nothing being done to try and stop staff from leaving. So yes, this is the question then, was this the point that served the killer blow to an already weakened NHS? Perhaps. And it's hard not to see this as the Conservative Party not acting in the public's best interest here at this point. I would like to know what interests they are acting in. The writing was very clearly on the wall that the NHS, or let me correct that, healthcare provision in the UK could not tolerate any more load than it was already suffering. We bear in mind that the UK is one of the only countries of all high income countries to reduce their healthcare capacity during the pandemic. And we bear in mind that it's still lower capacity now than it was before the pandemic started. And on top of that, we're going to add a relatively unmitigated surge in one of the most transmissible infections we've seen. So was this the killer blow? Perhaps. Arguably, you could say that Freedom Day was. Freedom Day, in the absence of any real measures to control and mitigate the viral spread. But yeah, certainly there were some big decisions made that has left us with a very poor access to healthcare, and now forcing thousands and thousands of people to go to private care, and thus achieving the division and the diminishment of the NHS. And I'm afraid it looks like it's not going to get any better, with now inflation to deal with, and a government that won't, that have, despite NI tax increase to support healthcare, are now refusing to put any money into the NHS, and with an actual real terms cut of almost 9 billion this year. I'm afraid that it doesn't look like it's going to get any better. Certainly ambulance waits have now gone even further up. They're now at 51 minutes. Waiting lists are at 6.6 million. There does not appear to be a will from leadership, from the government, to change this situation. And I think the question needs to be asked, was that a Conservative Party decision, or at least influence, that's left us in this position where I can call an ambulance with central crushing chest pain, maybe having a heart attack, and may have to wait almost an hour for an ambulance to turn up. And even if it does turn up, can I get into A&E? Can I get admitted? Can I get my angio in time? Same as a stroke, where we know time is brain, we can end up having to wait just an hour for the ambulance to get here. So, you know, we're in a certainly a very precarious situation, and it's certainly beyond what we can do in the front line to fix that. And unfortunately, it seems like certainly for England, the government aren't going to step in and protect us at this time.